My name is Ashley, and I'm going to be doing a newborn assessment today. So first thing, when I come in, baby will probably be sleeping. If they are, I would listen to their heart rate and count the heart rate, listen for a full minute. And then I would listen to the lungs on the sides. We want to make sure that they're equal, bilateral. Here, here, and here. Oh, this one's kind of hard. Next thing we're going to do is listen to their vowel sounds, making sure that they're active or hypoactive, because it's not uncommon for a baby to have hypoactive vowel sounds when they're first born. Okay, so they are active. We are going to start with the fontanelles. Okay, so there are two anterior and the posterior. You want to make sure that they are flat and soft. You want to feel suture lines. When a baby comes out, the suture lines are movable, so you want to make sure that they're not overlapping. You want them approximated, so like this. You want to look at the shape of the head. Sometimes when the baby comes out, their head is misshaped because of the birth canal. So you just want to kind of make sure everything, their head is, appropriate shape. Look for molding. That's what that's called. You want to see if they have a caput, which is fluid in the tissue around the head. You want to see if they have any like hematomas on their head. Really be looking at them. And with the cephalhematomas, which is the fluid on the head, broken blood vessels, you want to make sure that they don't cross the suture lines. Next, we're going to move on to the ears. Are the ears even with the eyes? If they're low set or have ear tags, that's something that we need to look further into. It could be with low set. It could be like Down syndrome. Okay, their eyes. You want to open their eyes, make sure that their eyes actually have eyeballs. And also you want to take note of any hemorrhages in the eyes. That is indicative of like traumatic deliveries. Nose. Okay, your nose. You want to make sure that both nares are patent, that the air is actually coming out. Mouth. Okay, mouth. So the sucking reflex, you would put a glove on, put your finger in the mouth, and let the baby suck on the finger. When they open their mouth, you want to see if their palate is intact, if their mouth is pink and moist. And right now you can also check their rooting reflex, which is where you put your finger in front of their mouth and they should reach for it. The neck. Is there any bruising on the neck? So we're going to start on the body. Now we're going to check clavicles here. Do we feel any difference in them? Are they equal? Are they low? Low set? Is there any evidence of like something traumatic happened during the delivery? Fingers. You want to make sure they have all their fingers, 10 fingers. I would do the grasp right now. See if they have good grasp. Brachial pulses here. You want to see if they're 2+ or, no, yeah, 2+. Okay, which would be normal. Cap refill, we can check on the sternum, or we can check on the top of the knee. And this one is kind of hard to do because it's plastic, but moving on. Nipples, are they parallel or are they low set? Parallel is ideal. We already listened to the bowel sounds. The cord. Okay, so you want to look at the cord. Is it a 2-vessel cord or a 3-vessel cord? If it's whatever it is, you have to see, normally it's, you want to see 2 arteries in a vein. What does the cord look like? Is it brown, miscolored? Is it a large cord or a small cord? Just kind of take note of, do you have a small baby? Do you have a big baby? If you have more of a smaller baby, then you can expect that the cord, it would be smaller. Or mom was a smoker. Stringy brown cords or skinny cords are indicative that mom was a smoker, or she did drugs or hypertension. Just the baby didn't have good blood flow to them. What's next? Femoral pulses. Okay, so femoral pulses we're gonna feel here. Let me a little lower right there. Are they palpable? That's the only thing we don't do 2+ or anything like that. We just gotta make sure that we can feel them. And also we gotta look at female or male. Female, we just got to make sure that they have all their parts where they're supposed to be. Males, we have to see if both of their testes are distended, excuse me. And also we have to look at the meatus. Is the opening at the tip of it, or does their hypospatus, which is where the opening is not at the tip, it's someplace else. And you want to make sure that their anal opening is there. Hip dysplasia. This baby, I'm not going to be able to. It's plastic. So basically, we're going to make sure. First thing is we're going to make sure that their legs are equal in length. Are their knees parallel? Now we're going to check for hip dysplasia, which is Barlow's and Orlandi maneuver. The Orlandi maneuver is you put the baby's legs in and then out. And if you feel like any clicking, that would be indicative of their hips being out of place or hip dysplasia. The Barlow maneuver is where you push them up and then in. If you feel any slipping, if you feel any slipping of the hip, then they would have to check to see if they have any hip dysplasia going on. In the hip dysplasia, if you see that the baby was breech, that's a pretty good indication that a baby will have some kind of hip dysplasia. Okay, toes. Are there 10 toes? Are they connected? Are they not connected? Is there any acrocyanosis of the feet or the hands or the lips? What's next? Babinski's reflex is where you would stroke the bottom of the foot, and you want the baby's feet to fan out, kind of like this. Spine. Okay. So for the spine, you're gonna make sure that there are no tuft to hair. If there's a tuft to hair, that's indication of a lesser degree of spinal bifida. What else? The dimple. Is there any dimpling in of the spine. Is it deep, or if there is a dimple in the spine, is it deep? Is it closed? Is it not closed? You just want to make sure that it's normal here. Reflexes. Okay, so again, make sure they have their grasp. At this time, I would do the head lag. It's where you lift the baby up and you want their head to lay back like this. And then the startle reflex is after I would do the head lag. If you want to test their startle reflex, what you would do is you would just drop them up like that, startle them, and they should, startle. Basically, if with the head lag, if the baby stands straight up, that is a hypotonic baby, and that's more like it's indicative of like withdrawal babies. So skin, you want to look for birthmarks, Mongolian spots, which are the bluish brown spots that babies get. You just want to make sure that you don't have any of them. Any stork bites, which is the accumulation of blood cells in one area. Bruising. If a baby has a lot of bruising, they're more prone to have jaundice, which yellowing of the skin, of the sclera. I think that's it. I just wish we were able to go to clinical and do this. I'm kind of set in better, but that is my newborn assessment.